Namaste, I'm Dr. Naresh Bana, and in this episode, I'm going to take you to the beautiful kingdom of Lesotho. Yes, I know many of you have not heard about Lesotho. It's a small kingdom which is landlocked within South Africa. Nearest port is Durban, and if you look at the map, it is towards south of Johannesburg. Lesotho embarked on the first hospital PPP of Africa. And they have done pretty well on the hospital PPP. It's a different case that the current government of Lesotho has cancelled the PPP with effect from 31st August 2021. And that's why we as PPP practitioners and interested stakeholders must know such cases. Let's have a look at the project. You can see the minister is talking about how they brought in the PPP. The World Bank Group came forward and along with IFC have financed this. The healthcare workers are very excited to work in the new facilities with the world-class equipment when this was launched in 2011. Queen Mamohato Memorial Hospital, Lesotho. This project was primarily supported by IFC and World Bank, and this is the first hospital PPP of Africa. And after inauguration in 2011, it's been functioning as a combined district hospital and tertiary referral hospital. It has 3 primary care filters as well. Total capacity is 425 beds. On 31st August 2021, the current government of Lesotho terminated the PPP and decided to run the QMMH on their own. But that does not mean this was not a successful PPP. Let's see how it was planned. In one of the most elaborate format of procurement, they decided to divide what is being procured, the scope of work, into 3 parts. That is the service coverage, patient volume, and service delivery plan. And accordingly, the bids were invited in 1 stage, 2 packet system. The PPP agreement was signed on October 27, 2008. Financial close happened on March 20, 2009, and construction began March 23, 29. The filter clinics, there's the primary health centers, started functioning in 2010, and hospitals started running in 2011. The total project cost was US $50 million with annual annuity payment of 25 million assured as per the concession agreement. The concessionaire, Sepong, held 67% in the special purpose company, while government of Lesotho 33%. There was no land risk because it was constructed at the place where earlier Queen Elizabeth II Hospital was standing, and there was substantial financial risk, construction risk, operations risk, and the major risk was the capacity shortfall risk. That is, if the facility is good, it will attract more patients, and because of which it may run out of the capacity. Then there was risk of retaining the qualified professionals, whether it was paramedical staff or the super specialists or the specialists. Also, in countries in Africa, the risk of political nature is much severe than anywhere else. The design of bid evaluation matrix proved to be very good, and it was helpful in deciding the preferred bidder in a very transparent way. The projection of future patient numbers was inadequate, and the capacity shortfall happened much before expected, before they could build additional hospitals, which they are doing it now, and because of which the disputes arose, and due to inadequate dispute resolution, the government took the extreme step of terminating the PPP last year. Thank you. Thank you very much for viewing this interesting episode where a well-running PPP has been terminated. And I'm sure you have enjoyed viewing it. It has added to your knowledge base. I'll be soon with you with yet another episode on an interesting case. Till then, keep viewing. Namaste. Have a nice day.